hall, so we will have Anchal speak about how does one market herself. And she has a lot of awards, I think, very dynamic surgeon who knows the game of social media marketing also very well. She practices in Chitranjan Park. So Anchal, we can hear it from you.
I've moved to GK2. My hospital has
All
shifted to
right.
GK2. Yes. So hi everyone. I'm Dr. Anchal Gupta. I'm here to speak about is as a solo practitioner is marketing ourselves really important. Interestingly, I'm sitting with people who are all doing really fabulous. So I'm sure they all know the game of marketing much better than me, and I have things to learn from them. But I have a proper marketing team and I have a allotted marketing day. So that's how we operate, that every Monday morning is the marketing morning, and that has worked very well. So we have dedicated days for our respective things, and then there's a Monday marketing morning. So I have decided marketing into several heads, and that makes it very very strategic and easy to distribute work among team members and to follow up how it um, goes on. So I'm also not just an eye hospital, I'm also an NGO which is working across 23 states of the country. So actually both of them are two separate entities, and both of them need actually taking care of two children at a time. And by God's grace, we have been able to very strategically manage it, and that has brought a lot of laurels and satisfaction together. So once we think about why we need to market ourselves, we got to understand first the potential. Whenever we are thinking of selling something, it's very important to understand that what is the potential. So we have to always keep in mind that our competitive landscape in India is 2 billion USD. So if we know why and how to sell what, we are eyeing at a mine of 2 billion USD. And I always tell everyone that if India has a population of 140 crore, then I have 280 crore patients. So that's a mindset with which we move forward. Cataract is almost 75% in our country over the age of 60 years. So yes, if the number of patients that we have is 240 crores, then two-thirds is three-fourths is our market. So whenever you think of selling yourself, there are too many eye hospitals in the city, and many of them are very well equipped. And especially as a solo practitioner, you cannot compete yourself with an established chain. That's a demerit, but that can also be a merit, because in today's time, while the five stars are thralling, it's the boutique hotels are the one who are gaining more popularity, because people are looking forward to customized places which feel their own, and which have something unique to sell to. So whenever you want to market yourself, mentally figure out what is your unique selling point. Probably you were a gold medalist, probably you studied from abroad, probably you studied from best of the colleges, probably you were doing something very different from rest of the people, probably you had a machine which nobody else has. For Netram, the unique selling point which we have been marketing over the years is that we cater to those who can pay, those who can pay less, or those who cannot pay at all. So always have in your mind that what is that you are going to market, and always do a thorough homework about what is selling in the neighborhood, so that you have something unique to sell. Figure out in your mind what is your target audience. Your target audience in terms of demographic, um, what is the age bracket you are really looking for? Are you like really centering yourself to become a refractive surgeon? There's an entirely different way you will sell yourself. Are you are really looking yourself to sell to the premium cloud, or to the lower segment of the society? So you have to make it very clear in your mind from the very beginning, because this is something which I realized over the years, that we can't sail on all the boats together. Of course, the other small boats would come to a shore, but there would be a ship which you have finally decided to sail upon. Figure out your demographic area, what area you are going to cater. This has a lot of implications in how you are going to planning your marketing, your team division and everything. So it's extremely important that you choose upon a demographic area, at least to begin with. When you have a limited team, when the team grows, you can of course keep on adding more demographic areas, but that clarity of border marking is also very important in the mind. Now, the marketing channels are basically, I always tell my team, it's a five pronged heads that we highlight upon: digital marketing, word of mouth and referral marketing, community engagement, traditional marketing, and channel partners. So grossly, these are the 5 heads in which the marketing teams are divided, and hence the follow-ups are taken up. So when we come to digital marketing, the first and foremost thing for anybody who is a solo practitioner is to have a Google business profile, and this Google business profile should be verified. Just like the Insta and the Facebook have a blue tick, a Google business profile also needs to be 100% complete, and this needs a good research. So there are a lot of courses online which can help you how to have a proper business profile. I learned it an year back, and I realized that it was a really important skill that I learned. So almost being 12 years in practice, 11 years, the Google business profile was thriving just in Google reviews. But when we cracked that there are so many other small things that can be edited in the profile, and then finally we can have a verified badge that now the profile is 100% complete, that makes a huge difference on how your business is going to show up. The other important thing is obviously to have a website. A website should be something which is very, very dynamic. It can be on a React platform so that you can have as much amount of data, and the loading time is not slow, and it should be a mobile friendly website. After having a website, it's very important to have a thorough SEO optimization with market sensitive keywords, which the professionals are capable of doing. But don't just blindly rely on the professionals. You have to simultaneously have an understanding of what is it that is going on, so that you can have an edge with the professional, giving the terms which you understand are important. Once the website is SEO optimized, it is then the time to do a Google and a meta ad. Unless and until the website is SEO optimized, there is no point doing a Google and a meta ad. It is not going to take you anywhere. In today's time, meta ads are more relevant and more centric than the Google ads. And of course, we can have small online courses to understand the hook behind these meta ads, creating backlinks, and creating your bringing your website on questions which indirectly lead to your business. Having your YouTube videos and your Insta channel has, my daughter told me, so a lot of people tell me that, oh Anchal, we keep on seeing your videos, it's so nice, but honestly speaking, it drains and sucks the life out of me. So one fine day I just was like, dude, yeah, I'm not gonna do this. So my 10-year daughter tells me that, mom, in today's time, having a YouTube and an Insta channel is almost like having chairs in your chamber. So this is the kind of clarity a 10-year-old had. And then when she said so, I was like, she's actually very, very right. She said the more you are, the more followers you have, is almost like as many chairs you have in your setup, and we can't undo it. So however cliche and uncool it might sound, and especially to generation like mine who is on the realm, I'm not the Gen Z, I'm not the oldie, I'm in between. I mostly mentally go to the side of the oldie, but still having your own YouTube channel where you are giving information, and having your Insta channel where you're giving your information is very important. If let's say it's not important for dragging the crowd, but your own patients will go back and retro check your authenticity. So after I started taking this sincerely, many of my patients came back and said to me that, doctor, we you told us so and so thing, and we went back and saw your channel, and then we listened to it, and we really liked it, and we also shared with our relatives. So if it is not bringing you direct market, somewhere it is helping set up your authenticity and your sense of acceptance in your patient crowd. So we can't undo it, however it sucks your life and soul. Email and WhatsApp campaigns. So if you would have noticed that these days, even Times of India and Hindustan Times, the newspaper, are having full blown one page ad of how WhatsApp business has helped small businesses. So again, this is something which we were not well versed of, and until 5 6 years back, we probably did not even give that much attention to it. But WhatsApp business is the future. There would be a time when Insta and YouTube would probably become too down the line in terms of importance, but the way WhatsApp business is developing, it's high time that us solo practitioners or anybody who's keen on building up the practice should take online courses to understand the WhatsApp business, to understand how you can integrate your WhatsApp number in your own Google business profile. Yes, that is possible. Many a times patients, they don't feel like calling the clinic, but if you are able to integrate our WhatsApp business in the Google business profile, they can directly take an appointment, and the WhatsApp business will in itself send the reminders and feedbacks to the patient. So this was about digital marketing. about referral, it's a dirty market, but then it may not always be dirty. So the way we connect with our referral partners, we always give them a value add. We provide them learning courses, so it's not just a money transaction of percentage between me and my referral partners, but I always keep it as a knowledge exchange. The benefit of keeping it as a knowledge exchange is that if somebody else is coming and giving them a higher percentage than what I was giving, still the probability of them being loyal to me, the probability is because I was adding value to their life. So the set of channel partners are opticals, chemists, GP, RMPs, um, and of course the market perks and engagements. Community engagements have dedicated camps. Over the years I've realized that having random camps here and there works no purpose. So figure out your target market area and continuously keep on doing camps in the same location if you really want the results to come back. So because that gives a sense of connection between the community and the organization, and that gives a better result. Of course there are RWAs, social organizations like NGOs, and again, these camps should not be just an eye camp. They could be a sense of value add where you can give a coupon that the patient can come back later to the center. Then there are organized sector like insurance, LIC agent, Anganwadi workers, ASHA workers, eye hospitals outside the city, Ayurvedic hospital, alternative medicine institution, schools, universities, college, corporates. The list is endless, and we can have a proper network channel with them and have a team which continuously goes and nudges them and organizes them for them. Conventional marketing in terms of newspaper, print media, there are now online news app where we can free keep on putting, so they are not paid, and there are apps like Public where you can just keep on putting your own news. If you have purchased a new machine, if there's a shift on something, you can add and get yourself reached among the public. There are methods of foot marketing where individuals can go and meet people and tell them about the organization. Once you have decided to market, it's very important that your brand is very clear. What is the logo, what is the font, and how you are ultimately building a brand recognition. They could be auto ads, bus ad, metro ads, signages, hoardings. Once you have reached that, you have taken up to a level, it's very, very important that you ultimately start building a brand recognition so that people have a recall. The moment they see that logo or a signage somewhere, they immediately recall, oh, we saw a YouTube video of her saying so and so thing. Partnership and growth strategies with online aggregators like Practo, Pristine, Aishman, CGHS Bharat, collaboration with insurance partners. They have their entire full network tying that up. Once you have decided, this is very important. Digital should be having an allocation of 40%, referrals 30%, community outreach 10%, and traditional market 20%. Once you have decided your budget, always have a monthly review of the key performance indicators so that you can figure out that which of the 5 laterals is performing how much. Should we need to invest more, should we need to invest less, and there should be a quarterly assessment. We might not take it very, very seriously, but if we start to take these steps seriously, it definitely brings a lot of difference in the way we are able to sell ourselves. This is my small team. This picture was taken 2 days before. Thank you so much.
Thank you, Anchal, for a wonderful, wonderful talk. I think this is something which is we keep wondering that what to do and what not to do. So you have definitely given a lot of clarity to how to proceed. And just a quick question that what is panelists' take on the amount of budget that we allocate to marketing and
Once you attend these kind of talks, you become inspired. You go and you start doing things, and then the inertia sets in. You are saying, "I'm so busy, I don't have time to do that." So it's a very ongoing process, as she said, and it should be like doing a cataract. So if you are doing 10 cataracts, you should say that okay, 2 hours I have to dedicate to it, which is very, very difficult.
Yes. Yes.
Because you are so busy in your practice once the practice develops. And then the budget, ma'am, then that is a very difficult question. But it,
Yes. Yes.
Dedicating 1 day for marketing. I think
No, so it's 2 hours on a Monday morning and 2 hours on a Thursday evening. So what I ultimately decided, what I ultimately realized is unless there's a block hour, so we call it block hour at Netram, and everybody knows that during these 2 hours, ma'am will be only with the team and nobody else. And for everything else, let's say I want to write a book. So I am writing a book simultaneously, which is another chapter. So for that also, we kept a block hour. So if you really want to be productive, see, definitely we are smart folks in the community, and that is why we have been able to reach where we are. But what stops us from reaching the highest realm is somehow we are not able to manage ourselves that perfectly. So block hour is a thing which really works a lot. You have to block yourself off everything, put your energy into it, and it gives the result 10 times more than what it would have otherwise possible chalta firta.
No, you're right. We've blocked our days for the conference. We can always block it
Exactly,
for.
right.
In
So,
fact, in if we have a team, then one of us can block a day for that.
yes. I was being modest. Yes, sir. So in the start of the presentation, I mentioned that I have an NGO, and the NGO is actually doing very well. It was awarded by the vice president of the country because I have not been able to put that in numbers, but our reach as an individual I organization has become the largest in the country. The number of villages and states that I've been able to reach is actually it's the largest network. In my case, that has an entirely independent team which goes, meets the government organization. I also participate in government tenders, and I have won tenders against organizations like Vision Spring, Center for Sight, Mahavir Internationals. I won those government tenders. So yes, I have a social Saturday as well. So social Saturday, I sit with my CSR team and work with them. So how it helps me that although that is Netramai Foundation and it is organizing community camps which are funded by my PSU partners and the government partners, but ultimately it is bringing brand value to Netramai Center, because the Netramai Center and I Foundation, although they are financially two different entities, but while I Foundation is growing up, it is bringing a lot of brand value and credibility to Netramai Center as an organization. And also lot of camps which I would have otherwise sponsored from the Netramai Center budget are being taken care by the foundation budget.